Good morning and good afternoon, everyone, and thank you so much for joining us for today's webinar. We are beyond excited to bring this webinar to you guys. Today's webinar is Arts and Health, Leveraging Cross-Sector Collaboration for Better Health Outcomes. And I'm going to go over just a few housekeeping items before I introduce our speakers. Currently, all participants are muted. We will unmute everyone for the Q&A component at the end of the presentation. But if you have a question that pops up as we're moving through the presentation, please feel free to use the Q&A or the chat function in the webinar, and we'll make sure to get to those questions at the end of the period, at the end of the presentation. This is a new webinar platform, so bear with us as we navigate through it. I'm already having a little unmuting issue for Vinny, but do please bear with us as we work through this webinar platform. So if anyone is having any technical issues, feel free to use the chat function to chat me and we'll try to work through it. But without further ado, I do want to introduce our speakers. We're very excited today to have Dr. Daisy Fancourt and Jill Sonke present for us. Dr. Daisy Fancourt is an associate professor in physiobiology and epidemiology at University College London. Her research focuses on the effects of social and community participation on health, with a particular interest in the effects of arts and cultural engagement. This includes laboratory studies on the effects of arts participation on neuroendocrine and immune response, behavioral studies on barriers and motivators to arts engagement, clinical trials of bespoke arts programs for specific health conditions, and statistical analysis of cohort studies and big data exploring the health and social impacts of arts engagement at a population level. Daisy's research has been granted over £10 million in funding and has received awards from the British Science Association, Leverhulme Trust, Wellcome Trust, British Academy, British Federation of Women Graduates, American Psychosomatic Society, Arts and Humanities Research Council, and the Royal Society for Public Health, and NHS England. Jill Sonke is the director of the Center for the Arts in Medicine at the University of Florida and assistant director of UF Health Shands Arts in Medicine. She serves on the faculty of the UF Center for Arts in Medicine and is an affiliated faculty member in the School of Theater and Dance, the Center for African Studies, the STEM Translational Communication Center, the One Health Center, and the Center for Movement Disorders and Neurorestoration. Jill is an entrepreneurship faculty fellow in the UF Warrington School of Business and serves on the editorial board for Arts and Health Journal and the board of Citizens for Florida Arts. She is also director of the national initiative Creating Health Communities, Arts and Health in America, in partnership with Art Place America. With 25+ years of experience and leadership in arts and health, Jill is an active research, teaching, and active in research, teaching, and international cultural exchange. I'm going to stop sharing my screen so that I can hand it over to Jill.
Daisy's up first.
Yes, that's right. Have you got my screen up now?
Yes, I can see it, Daisy.
Yeah, we can see it.
Excellent, thank you. Well, it's a huge pleasure to be involved with this webinar today. So I was going to start things off by talking a bit about the evidence we've been getting in the UK from studies over the last couple of years, where we've particularly taken a population level approach. Now, I lead a team of researchers in the UK, and we look at this general question about how arts engagement can affect health outcomes, what the mechanisms underlying this are, who seems to benefit the most from engaging, and as a result, how we can then encourage people to engage more in the arts. So my team runs laboratory studies looking particularly at neuroendocrine and neuroimmune response. We do behavioural studies understanding patterns and predictors of behaviours. We do intervention studies including large randomised controlled trials, And we also do these population analyses of medical records, big data, and particularly these studies called cohort studies that have tracked many thousands of people over decades of their lives. And it's really this that I'm going to focus on for this presentation today. So this area of work comes under the umbrella of epidemiology, which literally means the study of people. But it's essentially a statistical discipline that looks at how we can use big data to understand the predictors, risk factors for different diseases. So in the UK, we have these studies, that the first one of which started in 1946, tracking every baby born in 1 week, and tracked them over all of their lives since, with full medical records, educational records, brain imaging, blood biomarker studies, psychological assessment, etc. Now, what's brilliant about this study and about 6 others that have all been run by UCL, where I'm based, is that they actually contain between them nearly 400 questions on arts and culture, alongside these very rich medical and social data. So what we've been looking at is whether people who engage more in the arts have got better health than those who don't. And this is really exciting because it gives us a chance to look at some of the questions that we've explored over the last couple of decades in small scale studies, with large data that are representative of national populations. We've been able to track outcomes over decades rather than just weeks or months. And it also allows us to look much more at this issue of prevention, which is not something that's very easy to research with intervention studies. But the challenge with taking this data approach is that we're working with observational data. So a big question is, the people who engage in the arts, do they actually end up with better health outcomes just because they are already healthier and maybe wealthier initially? So what we do in this discipline is we try and map all the potential factors that could actually explain any link between arts and different aspects of health, like cognition. And we map them into our statistical models. So this is an example diagram for you, where you can see we considered demographic factors like income, marital status, ethnicity, education. We considered health-related factors like hearing, eyesight, depression, other physical health conditions. And we also looked at other social factors like social engagements, cognitively stimulating activities, and other types of civic activities. Now the question is, once you've adjusted for all of these factors, does there remain an independent relationship between arts and health? So all the results I'm about to show you have been adjusted for these factors. In other words, a relationship cannot be caused by any of these factors or many other factors we identified as well. So with that in mind, I wanted to tell you some of the findings from our studies over the last couple of years, looking at, first of all, mental health and then healthy aging. So let's start off with a question which really started to interest me a couple of years ago. There was so much coming out showing that arts activities could help in the treatment of depressive symptoms. But we wondered, well, could arts engagement across the lifetime actually reduce your risk of developing depression in the first place? So we've been looking at these with these representative large-scale data sets. This is a study we did of nearly 25,000 adults in England, where we found that those who engage in participating in the arts, and also those who engage with culture, they have lower overall mental distress and higher mental functioning and higher life satisfaction later on in life. So here we're finding that independent of all the other explanatory factors we could think of, arts are indeed associated with better well-being, not just amongst individuals, but at a population level. We also did a study about depression incidence in adults over the age of 50. We tracked just over 2,000 adults who didn't have depression or any history of any mental health problems, and we tracked them for 10 years. We found that the more often they engaged with the arts, the lower their risk of developing depression over this 10-year follow-up. So amongst people who never engaged, around 5 in every 100 would develop depression in a year, whereas amongst those who engaged once a month or more, only around 2 in every 100 would develop depression. So this equated to a 48% lower odds of depression incidence amongst those people engaging in the arts more than once a month. Now, this is population level, so it is always possible that there is going to be one person who engages in the arts every single day and still gets depression. But these analyses are looking at the population level. You would find a lower incidence in depression if people engaged more frequently in the arts. We've also looked at participatory hobbies, so people doing everything from arts and crafts to knitting, to collecting objects, to doing other kinds of arts-based activities. We found that engaging in these activities is associated with a 30% lower odds of developing depression. We've also looked at children as well as adults, and what we found is a very similar pattern with children. When we looked at about 7,500 children aged 7 and followed them up later on in life, we found that those who engaged more in creative activities had over half the risk of developing internalizing behavioral problems. So this includes things like depression, being unforthcoming, and writing off the opinions and thoughts of adults. So we're finding this pattern across the lifespan, which is really interesting. We've also been using some of the most up-to-date statistical methods that allow us to actually simulate experiments using cohort data. So we wanted to look at whether prescribing the arts to somebody could help to prevent their risk of getting depression. So what we did is normally in a randomized control trial, we would take people and we would randomize them into having cultural engagement or not having cultural engagement. What we did for this, to simulate a randomized control trial, is we took 2,500 people who were regularly engaged in arts and cultural activities, particularly going to museums, galleries, concerts, or the theatre. And we found them a matched twin, so somebody who was identical on all kinds of demographic, socioeconomic, health, and behavioural factors, but who just didn't happen to engage. And we followed these two groups up for 10 years. What we found was that those people who engaged had an 18% lower odds of developing depression than those who didn't really engage over that period. And this is the kind of study that it would be very difficult financially and ethically to run. Trying to get the money to tell people they were or were not allowed to do arts, that's going to raise ethical issues, and tracking them up over 10 years with a sample of several thousand people, this study in all was nearly 5,000 people, then again, that's not really going to be something that we can do with current funding climate or ethical rules. But these big data allow us to simulate these kinds of studies and get an approximation for the results that we would have received in a real experiment. We've also run similar simulations looking at prescribing the arts to help treat depression. And this issue of prescribing is very popular in the UK at the moment because we've got a rollout of what we call social prescribing, the idea that doctors can now refer people to arts activities in their community as a way of treating mental illness or other problems. And we found that those people in our simulations who had depression but were not engaged in hobbies, if they took up a hobby, they were nearly 3 times more likely to recover from their depression. Now, with all of these things, what we essentially have to ask is, why are the arts having these effects? And I tend to conceptualize the arts as multimodal interventions, in that they combine multiple different factors that we know are beneficial for health. So, for example, they involve cognitive stimulation, social interaction often, and gentle physical activity. Now, via these different components, the arts trigger different causal mechanisms. These can range from psychological mechanisms like self-efficacy and coping, to physiological mechanisms like reducing stress hormones or enhancing immune function, through to social mechanisms like reducing loneliness or enhancing social supports, or behavioural mechanisms like improving other health behaviours or increasing exercise. And these things are then what leads to health outcomes. But what's particularly special about the arts, I think, is 2 things. First of all, they often combine multiple different components in one go. So whereas some interventions only focus on physical activity or only focus on cognitive stimulation, the arts are very good at doing lots of these things at once. The second reason the arts are particularly powerful, I think, is because the arts involve a sense of meaning and purpose and resonance to people that actually provides an inherent motivation to engage. And therefore it can be a lot easier to get people interested in arts activities than it can be to get them involved in other health promoting activities. Unfortunately, I've not got the time to go into these mechanisms in more detail, but I can provide links to more papers if people are interested. But I now want to turn to looking at healthy aging as well, because this is something that, of course, is affecting societies in the UK and the US as well as further afield. So one of the things we've been looking at is cognitive decline. So we were asking, could engagement with arts and culture help to reduce cognitive decline in older age? And we looked at 3,500 adults aged 50 and above and tracked them for 10 years. And we looked at different assessments of cognition. And what we found was the more often that people engaged in arts activities like going to galleries and museums or the theatre, concert and opera, the better their memory was 10 years later. And also the better their semantic fluency, their ability to remember words and phrases was. Interestingly, this was particularly seen if people engaged every few months or more. Now, we didn't find this pattern for going to the cinema, but we ran some other analyses that actually focused on television and found that the more people watch television, the faster their rate of cognitive decline over the same period. So it's possible that because going to the cinema is a screen-based activity, this might be perhaps cancelling out some of the positive benefits that we get from other types of receptive cultural engagements. As well as cognitive decline, we've also looked at dementia incidence in older age. We tracked 4,000 adults over the age of 50 for 10 years, and we used a combination of physician-reported dementia or a particularly high score on a neuropsychiatric battery that we conducted. And we looked at visiting museums, art galleries, or exhibitions and found that the more often people do this, the lower their dementia incidence. So whereas 9 or 10 people in every 1,000 develop dementia in a year over the age of 50, if they are never engaging in arts and culture, only 2 or 3 in every 1,000 develop it in a year if they are engaging every few months or more. So this equates to a 44% lower odds. Now, this again, just to remind you, was independent of people's education, their socioeconomic status, their other health conditions, and particularly whether they were involved in any other types of community engagements like neighbourhood groups, church groups, social clubs or societies. We've also done a further analysis of this, with this time with 10,000 adults over 12 years. And we particularly, in these analyses, looked at 2 things. First of all, we actually linked our data with mortality data in the UK, and we identified everybody who died and then looked at whether the people who had died were likely to have died with dementia based on the previous data that we had on them. And if they'd actually died but were likely to have developed dementia had they lived, we reclassified them as a dementia case. So we were able to look in more detail at this dementia risk. And so this was one thing that was different. The other thing that was different was that we directly compared cultural engagement, which this time was museums, galleries, exhibitions, concerts, and the theatre as well, with social activities. Now, we know that socialising is beneficial for reducing people's risk of dementia, but we wanted to look at whether cultural engagement was as big a risk reducer. And what we found was it's almost identical, as you'll see from these 2 graphs. And this was whilst accounting for each other. In other words, as well as socialising, you get additional protective benefits against dementia if you're also culturally engaged. We've also looked at other aspects of physical decline, and one of the things we looked at was chronic pain, which is an interesting one because chronic pain is both a physical and a psychological problem. It's very much linked in with whether someone had an illness in the first place or some kind of injury, but it's also very strongly linked in with depression. And what we found was that people who are over the age of 50, who have no pain problem initially, over the following 12 years, they have a 26% lower odds of developing chronic pain if they're involved in vigorous physical activity once a week. But they've got almost identical risk reduction if they're engaged in cultural activities once a month. So this is very much picking up on that concept I spoke about before, about it being both a physical and a psychological condition. And this builds on other research that suggested that psychosocial community activities could reduce the risk of people getting chronic pain. We've also looked at other physical conditions like respiratory disease. We ran some analyses looking at 5,000 adults who were followed up for 16 years. And what we wanted to assess was those people who are more engaged generally in their communities. So this includes both arts and cultural activities, but also being part of any kinds of groups or any kinds of social clubs or societies, or doing any kind of volunteering. Whether these people who are more community socially engaged have a lower risk of developing a respiratory disease and needing to be taken to hospital with that problem. So this particularly was looking at things like hospital admissions for asthma or hospital admissions for chronic obstructive pulmonary disease. And what we found was that people who are more disengaged, so the black line here, they have a higher hazard of being admitted to hospital for these problems. And this is interesting because it suggests it's not just about developing the illness, it's also about how much you're then going to be using the health services as a result. So this has quite major implications for financial discussions around the benefits of the arts. We've also looked at age-related disability, which includes what we call activities of daily living, so things like eating, bathing, getting in and out of bed, and also instrumental activities of daily living, which includes things like managing money, taking medicine, being able to do housework. So again, these are things that are both physical, but also cognitive and psychosocial as well. We're going to be much less good at managing our money or our medicine if we're feeling depressed and isolated, and we are, as well as having any kind of physical impairments. So we again found that the more people are engaging in cultural activities, so this time it was museums, galleries, theatres and concerts, the less likely they were to develop a disability. So in every month we would expect around 6 people in every 1,000 over the age of 50 to develop disability if they're never engaging, whereas we'd expect only 2 or 3 in every 1,000 if they were engaging every few months or more. Now, the reason this is interesting in particular is if I compare these grey bars, which are cultural engagement, with these orange bars, which show moderate exercise, we're finding almost identical differences. In one of the analyses here, we're finding actually the grey bars are lower than the orange bars, suggesting that overall the incidence is even more affected by arts than it is by exercise. And in other analyses, the red arrows, we're showing that the individual risk is somewhere between 44 and 46% lower if people are engaging every few months or more. We've also looked at frailty. Now, frailty combines lots of the things I've already spoken about. So things like depression, cognition, mobility, chronic pain and other health conditions. So it's going to come as no surprise to find that we find there's a lower incidence of frailty in older adults the more they are engaging in arts and cultural activities. So if we imagine somebody at the age of 80, they're 1.3 times more likely to be frail if they've never engaged, if they are never engaging in these activities compared to if they're engaging every month or more. And this was a study of about 4,500 adults over a follow-up period of 12 years. But even if you do become frail, what we find is there's actually a slower trajectory of frailty progression the more people are engaged in cultural activities. So you essentially want to steer clear of the line on the right-hand side of this graph. So you'll see that going to galleries, exhibitions, museums, or the theatre, concert, or opera, you're managing to have a slower trajectory, staying away from this line the more often you're engaged. And interestingly, we're even seeing this for cinema this time as well. And finally, I just wanted to sum all of this up by talking about mortality. In the 1990s, there was a paper in the BMJ, the British Medical Journal, that said that adults who engaged more in the arts actually had a lower risk of premature mortality than adults who didn't. And this built partly on evolutionary theories of the benefits of the arts, but partly on everything I've already spoken about. So the idea that the arts can have effects on a wide range of aspects of physical and mental health, and that if we add these together, it could start to have an effect on mortality. Now, we had looked back at these analyses from 25 years ago, and we decided to update them using more recent data sets, longer follow-up period, larger sample, and a much richer list of things that we thought could confound or explain this relationship. And I'm delighted to say our paper has just been accepted in the British Medical Journal as well for next month. And we've found the same patterns. The more people are engaging in arts and cultural activities, the less likely they are to die prematurely. And this, just to reiterate, is not explained by things like education, socioeconomic status, mental or physical health, health behaviours or social behaviours. It is independent of all of those factors. And I very much think this is down to this concept I spoke about earlier, the idea that the arts are multimodal health interventions that have the potential to target multiple different mechanisms that we know are beneficial for health. I just wanted to wrap up by mentioning a report that's coming out very soon that I'm hoping might be of interest and relevance to everybody's work. For the last 18 months, I've been working with the World Health Organization, and we've been producing an evidence synthesis report on arts and health. Now, particularly, we've tried to look at as many peer-reviewed scientific papers we could possibly find. And we've actually involved in total 3,700 and something studies. Now, a lot of this focuses on management and treatment, as you can see on the right-hand side of this diagram. So we particularly found there was a lot of evidence on how the arts can help in the treatment of mental illness, including perinatal mental illness, mild to moderate mental illness, as an adjunct treatment for severe mental illness, and also supporting people who have trauma or a history of abuse. There's also a large literature on how the arts can help both in the treatment, but also the broader support around acute conditions, neurodevelopmental and neurological disorders, and non-communicable diseases. And there's also a very rich literature on how the arts help in palliative care and bereavement, end-of-life care. But what we also focused on was very much this issue of prevention and promotion. And this is something we feel hasn't been discussed as much, but is absolutely critical to understanding how the arts affect health. We found a lot of literature on arts helping social determinants of health, including social cohesion and social inequalities. We also found a large literature on child development, so the arts helping in mother-infant bonding, speech and language development, and educational attainment. A rich literature on how the arts help in caregiving in terms of our understanding and conceptualizations of health, but also in terms of improving clinical skills and the well-being of formal and informal carers. Then there's also the prevention literature I've just been describing to you today on how the arts can be risk-reducing factors or health behaviours for a range of conditions. And finally, how the arts can help to promote healthy living, including reducing health-related stigma, engaging hard-to-reach groups, and helping in health communication. So this report comes out on the 11th of November via the World Health Organization, and I'm sure we can find a way to circulate it to those of you listening today as well. So this essentially has been a bit of a whistle-stop tour over the type of work that we're doing in the UK, which has been really focusing on these cohort studies and looking particularly at this issue of prevention. And it's also been a chance for me to tell you about the World Health Organization report, which is shortly coming out. I'm going to hand over to Jill in a moment to talk about this more, but I would just say that I think this is a very exciting opportunity because prior to 2 years ago, there was no data on these kinds of questions on prevention in the UK. But this has very much grown over the last 2 years from the work that my team have been doing. And what we're really starting to ask now is, we're seeing these results in the UK, but actually could we be starting to look at data sets from other countries as well to make sure that we're actually able to start replicating these findings in different populations. So I'm excited overall that we're seeing more interest from the US in particular on these issues around public health and communities in the arts as a way of supporting public health. I'm also starting to hear interesting discussions from US colleagues on issues around social prescribing, which is a huge thing in the UK, but I know has yet to get the same kind of momentum in the US. But I'm very much hoping that this prevention agenda that we've been exploring with the arts in the UK can be replicated in the US in the coming years. So with that, I'd like to hand over to Jill. It's been my pleasure to work with Jill over the last few years. And she's going to be telling you a bit more about the public health work that she's been leading in the US.
Thank you, Daisy. Hi, everyone. It's really a pleasure to spend this time with you this afternoon. I'm going to follow on that amazing presentation by talking about a national initiative that we've been leading here at the UF Center for Arts and Medicine in partnership with ArtPlace America. It's an initiative that's really centered around building cross-sector collaboration between public health and arts and culture in particular, and also the community development sector. And it really builds on this relationship between the arts and health that Dr. Fancourt's amazing work is bringing forward in such exciting ways. So this initiative is a multifaceted initiative. It's about discovery and collaboration, and it's largely, and at its heart, a translational initiative and has dissemination phases as well. So I'm going to overview the activities of this initiative and then end up with circling back to some work that Daisy and I are proposing, similar to the work that she's been doing in the UK. So this initiative has included knowledge sharing and collaboration in very significant ways. So knowledge sharing has happened through a series of 9 national convenings, which we just wrapped up last week with the final convening in Corvallis, Oregon. So these convenings, 9 of these convenings, were working groups with about 50 invited individuals who centered dialogue around very specific topics, different topics like practice, research. We had a national policy convening in Washington, D.C., our convening in Lexington, Kentucky, focused on equity and social cohesion. And as well, we convened a full national conference in Orlando, Florida, with about 300 people participating in that event. It was live streamed as well, and those videos are just about to go up on our website, by the way. So all of these convenings were considered a part of our research agenda in that we transcribed all of the dialogues and conducted thematic analyses of those dialogues to bring forward really key themes. And those dialogues happened between an array, a really diverse array of people. So in total, not including the conference, we gathered 340 thought leaders. And those folks came from the arts, public health, and community development sectors. They were artists, researchers, educators, administrators, funders, policymakers. So really diverse groups of people to discuss these issues. And the themes that came forward were merged into our full research agenda, which included not only that gathering of what we considered the present and future state of the connections between the arts and public health in America, but we also did some surveying, some focus groups, and evidence synthesis. So we conducted a national field survey. We had almost 600 respondents and analyzed just over 400 of those responses to find out what kinds of work is happening in this space at the intersections of the arts and public health. We learned about the kinds of partnerships that were happening, the types of evaluation and research that were happening, the kinds of art forms that were being used, and the sorts of goals and outcomes that are engaged in those programs. We also conducted focus groups across the country to talk with people doing this work to better understand the operational knowledges that are at play currently in this work. And we conducted evidence synthesis as well. We did 2 scoping reviews, one focused on how the creative arts have been used in the United States to improve well-being, and another focused on how the arts have been used to facilitate health communication at the community level in the United States. We're also finishing up a systematic review right now, which we're very excited about how the arts have been used to address suicide prevention and survivorship in the US, Canada, the UK, and Australia. So in this research agenda, we've been very focused on kind of doing the heavy lifting on behalf of the field. We wanted to do some of the big work that can often be a barrier for people proposing work and programs in this space. The literature on arts and public health in the United States and certainly beyond is vast because this work is not new. Public health as a sector has been engaging the arts throughout time, but has not really been doing so formally and has not been doing so with any clear evidence base. So when you look at the literature in this space, what you find is a lot of literature, a lot of different methods, a lot of different keywords, and it's very difficult to get your arms around. So we wanted to do that big work through the scoping reviews and through the systematic reviews. We wondered if we might meta-analyze as well, but not surprisingly, we found a lack of consistency in methods, and so we're not really able to meta-analyze this literature effectively. But we wanted to provide the field with some evidence synthesis that could be used as benchmarking, be used in proposals for funding and for programming. So our goal of consolidating the literature has happened through those methodologies. And we've also focused on methodologies. How do you search this literature? It's quite complex. Those of you who have done this work may know that even using the term arts can be difficult in evidence synthesis because you'll get a lot of studies on antiretroviral therapies, for instance, or a lot of studies that say that their intervention is state of the art. So we've developed a guide for search strategies in this space and have sought to provide methods that can be of assistance to people doing this sort of evidence synthesis work. So search terms and strategies. At its heart, as I mentioned, this is a translational initiative. We have sought to bring together the current and future state knowledge that's come through those working groups with the formal research that we've conducted, and to translate that into policy and practice in the United States. And we've done that through a series of resources that we've made available. I'll talk a little bit more in a moment about the white paper that we've released over the past several weeks. We've also recently released the first of 3 governmental advisory briefs. We released a state-level governmental advisory brief at the National Association of State Arts Agencies Leadership Summit a few weeks ago, and we're just about in the next couple of weeks to release a municipal, local, and county level advisory brief and a federal level advisory brief. And we're working with partners in the arts and culture and public health spaces to disseminate those briefs. We also are submitting a number of papers for peer review, and we'll move this spring into developing an evidence-based framework for using the arts in public health, which will bring all of this work together through a theoretical frame, recommendations for practice, and examples of practice as well. We've also created a national network, which I encourage you all to join. It's a Facebook-based network that you can find on our website. On our website, we've also got a beautiful blog and interview series where you can hear from people doing this work, including policymakers and national association and agency leaders. We're launching this coming month a webinar series. November 12, we'll have the first of 6 in our free webinar series. So again, that information is available on our website. And several months ago, we launched a beautiful resource repository, so an open access web-based space where you can find the people, programs working in this space, as well as reports and examples of media. We also have a graduate certificate in arts and public health and are developing more professional development opportunities in this space. So the white paper that I mentioned is also available for download on our website, and it's a paper that's really centered around driving cross-sector collaboration between these 3 sectors: public health, arts and culture, and community development. And it's really targeted toward the public health sector, recognizing that, again, public health has long been utilizing the arts and creative engagement in its work, but not so with a strong evidence base and with clear recommendations. So this paper brings forward 5 key issues, and these issues came forward through, again, the thematic analysis of all of these national convenings, the research that we've done, and as a final step, we convened 12 leaders in the field from across these sectors, and we sequestered for a whole week in Florida, and we examined all of this data, looked through other primary field reports, including Healthy People 2020 and the Plan for Healthy People 2030, and we identified 5 key issues that would serve as really important examples of how arts and culture can be utilized in public health interventions and programs. Those issues are collective trauma, racism, mental health, social exclusion and isolation, and chronic disease. And so the paper brings forward examples of how arts and culture can be utilized as a partner, sector-to-sector partner, and also how arts and cultural resources are available resources in every community and can be engaged to advance the effectiveness of these public health programs. So the paper offers examples in each of these areas, recommendations, and examples of what success looks like when arts and culture and public health are partnering and collaborating effectively. So Daisy and I have been collaborating, as she mentioned, over the past several years, and we've begun to talk more and more over the past year about how we can do the kind of work that she's doing in the UK in the United States. And so Daisy has scoped 7 data sets in the United States that somewhat parallel the data sets that she's using in the UK. And we're planning to collaborate between UF and UCL to create what we're calling the Epi Arts Lab to explore these US data. And Daisy, I'm going to turn it back to you to say a little bit more about this proposed work.
Thanks, Jill. So we've been looking at some of the US data sets and essentially scoping out what could be done. And it turns out you've got the most amazing resources in the US, particularly data sets that allow us to look at some of the things we've not been able to look at in the UK, but that seem very interesting. For example, whether arts engagement is linked in with a lower risk of opioid use. Because given we found the results on chronic pain, we're wondering if this actually translates through to medicine use as well. Or, for example, there was excellent data in some of the US cohort studies on things like violent crime in neighborhoods, and this would be another brilliant social determinant of health that it would be great to see if the arts are actually helping to reduce. So Jill and I have been exploring options for how we could use these cohort studies in the US and start to replicate some of the UK findings. Now, if we can replicate the same finding but in a different population, that massively strengthens our belief in the data that we're getting back. But like I mentioned, it also gives us a chance to look at the types of questions that we haven't been able to look at so far. And it's also important to remember that we need to check that these activities have the same impact in the US as they do in the UK. Now, we're assuming that they do because our countries are fairly culturally similar, and I think our shared language makes them feel particularly culturally similar as well. But interestingly, other public health studies have sometimes shown differences, partly because there are differences in our population demographics, but also some other health behaviours have stronger or weaker results depending on the populations. This will be a brilliant chance for us to explore all of those issues in more depth. And we're very much hoping that we'll be able to do what we've been doing in the UK of carrying out these analyses and then feeding directly into policymakers and also to community organisations themselves to help them design their work.
And one of the first steps that we'll take in the first year of this project is in alignment with what we've done in the national initiative to convene folks who are thinking in this space and consider how we would do this research in the American context, recognizing that our medical system, our political system, our social systems are quite different. So we'll be looking for input to guide the outcomes that are focused on in this work as well. So we're quite excited about this opportunity in the future. Erin, I'd like to pass it back to you now to facilitate Q&A.
Great, thank you so much, Jill and Daisy. Speaking for myself, I am amazed and excited about this work that you guys have been doing. I've worked in public health for a long time, and I think this is such an exciting place to be, and I'm excited to read your white papers and do some digging on all the resources that you mentioned, and I can commit to sharing those with our network. But before I open it up for questions, we weren't able to unmute Vinny earlier, and he did want me to just read something for him really quick, and then I'll open up the lines for questions. But Vinny just wanted to say good afternoon and thank you. Vinny, for those of you that might not know, Vinny's the president and CEO of the National Network of Public Health Institutes. For many of us that have had life experiences with direct participation in the arts, we know in our heart of hearts that they are good for us. For Vinny, as a dad, his dad was a musician, and they grew up actively making music, in retrospect, which may have possibly even reflected an intense obsession, which continued for nearly the first 2 decades of his life. But these feel-good experiences are really beneficial. As public health professionals, we are compelled to seek evidence to inform our work, and we must balance the multitude of competing demands on our resources. Vinny's delighted to share this webinar with you today, and he thinks it's a very special day, and I agree for all of us. It's a very unique and important webinar, and as we saw, now we know why. Vinny's honored to have met both Jill and Daisy, and he says that you guys are amazing professionals, and as we saw, you have officially knocked our socks off with compelling evidence of why public health and the arts are so well matched as natural collaborators. So he just, from the bottom of his heart, wanted to thank Jill and Daisy for sharing their expertise with us. And so now I'm going to unmute everyone. So your lines will be unmuted if you have questions, but just please feel free to speak up. But I do ask, if you aren't speaking, if you could just mute yourselves to eliminate background noise. If you don't want to speak up and you want to put your question in the chat function, we can manage the questions that way. So I'll go ahead and unmute everyone right now. So your line should be open if anyone has any questions. I'll go ahead and get it started. I jotted down a question. So as I mentioned, I've worked in public health for many years. For many of those years, it was on the implementation of programs. And I just had a question, as you mentioned, prescribing the arts. A few years ago, I worked on a program where we worked with doctors to prescribe fruits and veggies. And I also jotted down when you were talking about the research on screen-based activity. So my question really is, has there been any studies on the, or programs on the kind of the implementation of actually prescribing arts, or looking at, I know a lot of school programs and youth programs look at screen-based activity, lowering that for kids. Do you have any information or data on some of the actual implementation of any of those initiatives?
We certainly are starting to get some of these. So in the UK, my team are working on some of the analyses of the impact of social prescribing rollouts using medical records from primary care, secondary care, and acute care, along with social care records. And we're literally starting that project this week. In terms of other studies, there's also a new program of work that I've launched today with colleagues at King's College London, where we're trying to upscale 3 interventions where there's already promising data and actually do research on the process of implementation, so taking what's called an implementation science approach. So this is scaling up a program of dance for Parkinson's disease, mixed arts for stroke, and singing for postnatal depression. And we'll be reaching over 700 patients over the next couple of years with this program. And we'll also be looking at the acceptability, suitability, and feasibility of embedding these programs within our healthcare system. So we are getting lots of studies that are doing evaluations of practice, but I think what's exciting is when we start to move this through to either health economic analyses, which we don't really have as many of, or these analyses actually studying the process of implementation so we can understand what works well and can therefore be used for other arts activities versus what are the barriers and challenges that we need to be prepared for.
And Erin, I just wanted to mention on the subject of social prescribing, right now, Western Massachusetts is running a social prescribing pilot. So this is a really exciting thing that's happening that I'm watching closely. It's running now, and I'm hearing in other communities, some Native communities in the United States with internal health systems, some bubbling up of social prescribing programs as well. So the data that Daisy has shared today and what's happening in the UK is a really exciting model in the United States. Clearly our health system is entirely different, but we're seeing some pilots bubbling up that are exploring how this kind of thing can happen in the United States.
Thank you so much. So I have a few questions that popped up in the chat, and I'll go ahead and read those out loud. We have one question that said, wonderful presentation. Would you be able to include the New Orleans Musicians Clinic's 2,500 plus patients EMRs in your research?
Daisy, do you want to take that one? Nope. Did we lose Daisy? Are you there?
Yes, sorry, I am here. My line went a bit funny. Would you mind repeating the question?
Yes, wonderful presentation. Would you be able to include the New Orleans Musicians Clinic's 2,500 plus patients EMRs in your research?
Do you mind if I ask what EMRs are? Electronic medical records?
Yes.
Yes. So if you have electronic medical records for patients, then that certainly sounds an interesting thing to look at. What we'd need to know is whether those people had the arts, and perhaps as well know people who hadn't had the arts, so we could compare. And I think in terms of looking at that data set, it would be good to know the kind of relative size. So the analyses that I do tend to work better when you're into the thousands of people rather than the hundreds. So you have enough statistical power for what you're trying to do. But it certainly sounds interesting, so do feel free to drop me or Jill a line afterwards if you'd like us to look at the feasibility of this, because we are currently scoping out which data sets look the most promising to work with.
Thank you. We had another question through the chat. So thank you for this fascinating presentation. Can you share some thoughts about accessibility? There are often physical and financial barriers to participating in the arts. The ability to navigate art spaces if you have a disability, or the ability to afford participation. Are there models of how communities mitigate these barriers?
I love this question because I've been asking this with my team very much over the last couple of months. So we're actually doing a whole program of research at the moment on barriers and enablers of participation amongst different groups. So we've got a whole suite of papers coming out soon. These include a close analyses of how arts activities vary based on socio-demographic characteristics and economic characteristics. We've also been looking at where the participation is lower in people with mental illness, which it seems to be. So we're now doing some analyses to look at why that is. Is it just that people with mental illness have a higher likelihood of being lower socioeconomic status, or is it actually something around the mental health aspect? And it seems that there's something specifically around their mental health that is causing the problems here in terms of participation. So as a result, we've got 2 new programs that we're starting, one of which is Big Citizen Science program, where we've gathered new data from 45,000 people about their barriers and enablers of engaging in the arts. And we're now analysing these in different groups to see what these barriers are, and then come up with a template of what types of interventions could be used to address these. The other project is doing qualitative work with lots of focus groups with different groups, including people with mental illness, including community arts organisations themselves, about what the barriers are to them trying to deliver this kind of work. And we've got a suite of new models that we've built from this research that we're going to be releasing over the next few months. And then finally, we're also getting very interested in the question of place. So how much does it matter whether you're based in an urban or a rural setting, which part of the country you're in, how deprived your neighbourhood is? Does this actually affect your participation, perhaps because there is simply less to engage in? And might it even moderate your relationship between doing these activities and health? And our tentative findings are suggesting that those people living in more deprived circumstances can actually benefit disproportionately more from the arts than from people of higher up socioeconomic status. And this is very exciting because it suggests that the arts could genuinely help those who need the most help. So a lot of this is still to come. So I'm sorry I can't show you all the results from it, but just to say, do keep an eye out, because we've got about a dozen different papers on this coming out over the next 6 months or so.
So great. And just to note that the National Endowment for the Arts and the Kennedy Center in Washington, D.C. both have really excellent resources for accessibility online.
Thank you. Do we have a few more minutes for questions. Are there any other questions for Daisy or Jill? And I just wanted to read, in case you guys didn't see it, and I'm not sure who typed this, but it says that we are working hard in Massachusetts to begin a pilot in social prescription. Your work has informed ours significantly, and we're looking forward to expanding this further. Thank you so much for your hard work.
That's great. I'm glad someone from Massachusetts is with us.
All right, last chance for questions. Great, and if any questions come to mind, any of our attendees, feel free to email me, Erin Fitzgerald, and I can make sure that Jill and Daisy get those questions. And what I'll also do is, they mentioned quite a few resources and white papers that will be coming out shortly. I'll keep my eye out for those and share those through our top 5 through our membership newsletter, so that everyone can have access to those. And again, Jill and Daisy, I just want to thank you so much for your time today. Daisy, I know it's quite late in the afternoon over there, so we definitely appreciate it.
Not at all.
And are
it was
excited. Yeah, and we're excited to continue the collaboration and see how we can potentially work together moving forward.
Thank you, Erin. Thank you, everyone.
Thank you so much, everyone. Bye-bye.